Radiology technicians, RTs, are essential members of the healthcare team, specializing in diagnostic imaging to support physicians in assessing and managing various medical conditions. Their expertise lie in operating advanced imaging technologies, including X-ray machines, computed tomography scanners, also known as CT scanners, and magnetic resonance imaging systems, MRIs, to produce high-quality images of internal structures in our body. One of the most important aspects of their job is ensuring safety. RTs follow strict radiation protocols, using lead aprons, shields, and other safety measures to minimize exposure for both patients and staff. They also carefully evaluate the quality of each image, adjusting equipment settings and patient positioning to get the best possible results.
So physiotherapists are the healthcare professionals who improve the physical health and functional independence by diagnosing and treating movement, strength, and balance issues through their personalized treatment plans, and they help to manage the pain, recovery from the injuries, surgery, and the chronic conditions using a technique such as manual therapies and therapeutic exercises and modalities like heat, cold, and electric stimulation. In addition to rehabilitation, the physiotherapist educate patients on their proper body mechanics, postures, and injury preventions, and empowering them with the tools for the long-term recovery. And their holistic approach promotes improved mobility.
The Alberta College of Medical, Diagnostic and Therapeutic Technologists outlines the mandatory continuing competencies a radiological technologist must complete. Each year from October 1st to September 30th, all college registrants are to complete a reflective practice review that is 3 components: the self-assessment, a learning plan, and participate in reflective learning activities. These 3 components are mandatory. The self-assessment includes an internal evaluation of the registrant's practice against the standard of practice governing the registrant's area of practice. A learning plan includes the development and implementation of a learning plan that follows the registrant's professional development requirements identified in their personal assessment. A learning summary is the participation of 12 learning hours and the record of all learning activities, including evidence and documentation of how these learning activities have addressed the professional development requirements identified by the registrant.
For physiotherapy, to maintain your competence, you must complete 2 competence programs per year, 1 college-chosen and 1 self-selected. Self-selected activities have 3 categories: self-assessments, activities, and group activities, and aim at improving personal competence, patient care, and healthcare services. Self-selected activities aim to achieve deeper learning and are recorded on the practice improvement record, which is required as 10% of these records are assessed yearly by the college. For college-chosen activities, they are created to increase awareness in ethics and care to keep recurring problems from occurring again. As an example, last year's topic was informed consent. Unlike self-selected, these activities are the same for all members of the college.
Some of the values that are found in the Physiotherapist Code of Ethics are responsibility, honesty, integrity, respect, dignity, communication, collaboration, advocacy, and well-being. These values can also be found in the CNA's Code of Ethics.
The Code of Ethics for Radiologic Technologists was created by the Alberta College of Medical, Diagnostic and Therapeutic Technologists. In this code is Principle 1, Responsibility to the Public, which outlines 9 ethical responsibilities that RTs must consider while practicing. These responsibilities are competent care, diversity, dignity, confidentiality, collaboration, informed consent, professional judgment, professional boundaries, and record management.
There are also differences between the 2 professions' Code of Ethics, particularly in the aspects of advocacy, social justice, and compassionate care. Nurses are called to advocate for social justice and equity in healthcare, addressing health disparities, and attempting to reduce barriers that prevent access to care. Physiotherapists, on the other hand, are not expected to address these systemic issues. In regard to advocacy and social justice, it is limited within their own practice, whereas in nursing, they are expected to extend their advocacy beyond the workplace. Although both professions promote safe, competent, and ethical care, nursing puts a greater emphasis on compassionate care compared to physiotherapy. Providing compassionate care is central in nursing as it helps build trust and rapport with clients, allowing them to provide holistic care. While compassion is still important in physiotherapy, a greater emphasis is placed on professionalism and respect as they provide specialized care.
The first difference is that the RN Code of Ethics is quite broad, so it encompasses the entire scope of nursing practice. The Radiological Technologist's Code of Ethics is more specific, so it focuses on the ethical responsibilities related to technological procedures that are done. The second difference relates to patient advocacy. The RN Code of Ethics stresses patient advocacy and promotes health and well-being. The Radiological Technologist's Code of Ethics also endorses patient-centered care and advocacy, but more in the sense of maintaining patient dignity during imaging procedures and minimizing harm or discomfort during the process.
The scope of practice between physiotherapists and registered nurses can be quite different. Physiotherapists specialize in the musculoskeletal system and focus on optimal movement and function with their patients. However, RNs have a much broader scope of patient care and can work with any body system. Another difference is that physiotherapists can diagnose a disease, a physical dysfunction, or disorder, whereas RNs develop a nursing diagnosis, focusing on the human response to a medical diagnosis versus the disease or dysfunction itself. However, both RNs and physiotherapists conduct patient assessments. Before working with a patient, they will go through their health history and conduct a physical assessment so they can develop the best course of action and care for each patient.
One difference relates to assessment and diagnosis. The RN scope of practice is quite broad, so it allows nurses to assess patients, provide care, and form nursing diagnoses. Radiological technologists, however, have a more specialized role involving imaging and diagnostic procedures, so they would not necessarily comprehensively assess and formulate diagnoses. Another difference relates to patient care and interventions. RNs can provide many direct, hands-on patient care, such as medication administration and wound care. Radiological technologists, on the other hand, provide care in terms of imaging and diagnostic procedures. A similarity is that both scopes of practices involve educating patients so that patients can make informed choices.
Radiological technologists have quite a bit more overlap with RNs than you may think. In hospitals, RTs work with nurses in areas such as the OR, emergency department, and outpatient clinics to collaboratively provide diagnostic information for doctors to diagnose and treat patients. They also use nurse input on how to collect this data in ways that are client-centered. A second example of where RTs work directly with nurses is in procedural areas. Here they work together before, during, and after procedures to ensure client comfort and safety, especially during sedated procedures. For these procedures, the RT and nurse work in tandem, with the RT running the procedure while the nurse monitors the patient through things like vitals. Nurses may also assist RTs in positioning clients with complex needs or in managing client anxiety to keep procedures smooth. Nurses also provide RTs with pre-assessment data and provide patients with procedural instructions to ensure RTs can do their job effectively and procedures remain successful.
Physiotherapists often work with registered nurses in hospitals and long-term care. In the hospital, physiotherapists aim to restore patient functionality by addressing injuries, surgeries, and medical conditions with manual therapy and exercise. Physiotherapists collaborate with RNs to ensure coordinated care, especially when mobilizing patients or adjusting treatment plans. In long-term care, physiotherapists shift to preserving mobility and preventing further decline in patients with chronic or age-related conditions. They aim to maintain strength, balance, and independence to reduce falls and support daily activities. Physiotherapists work with registered nurses to monitor changes in patient condition and adjust care strategies accordingly.